Hi everyone, welcome to our channel Canadian Nurse Expert. You know, being a nurse is more than just a job. It's about making life-changing connections with our patients. It's about advocating for them when they need it most. And a huge part of that is being prepared, knowing your stuff inside and out. That's why we're here today, to tackle a topic that's close to every nurse's heart. Perfusion. In this video, we're diving deep into 5 Next Generation NCLEX-RN questions that'll test your knowledge and get you ready to rock that exam. So buckle up, grab your stethoscopes, and let's get started. Alright, picture this. It's a busy day on the telemetry floor, and you're called in to assess a new patient, Mr. Johnson. Now, Mr. Johnson is a 72-year-old man with a history of hypertension and type 2 diabetes. He's been feeling a little under the weather lately, experiencing shortness of breath, fatigue. You know that feeling like you just can't catch your breath? And to make matters worse, he's noticed some swelling in his ankles. Not a good sign, right? Swelling in the ankles can often indicate fluid retention, which might be a symptom of something more serious. So, you take his vitals, and here's what you get. Blood pressure is a little high at 165 over 90 millimeters of mercury, heart rate is racing at 105 beats per minute, respiratory rate is elevated at 24 breaths per minute, and his oxygen saturation is sitting at 92% on room air. Now, I'm sure you're already forming some ideas about what's going on with Mr. Johnson, perhaps considering conditions like heart failure or a respiratory issue, and that's exactly what we want. By piecing together his symptoms and vital signs, we can start to form a clearer picture of his health status and determine the best course of action. Okay, future nurses, time for our first NCLEX-style question. Based on Mr. Johnson's presentation, what would be your priority nursing intervention? Is it A, administer a prescribed diuretic, B, encourage ambulation to reduce swelling, C, apply oxygen therapy at 2 liters per minute, or D, restrict fluid intake to 1.5 liters per day? Take a moment, think about Mr. Johnson's symptoms and choose the best answer. Alright, time's up. The correct answer is A, administer a prescribed diuretic. Remember those swollen ankles and his history of hypertension? Mr. Johnson's symptoms point to fluid overload, a common complication of heart failure. Diuretics are our go-to for helping remove that excess fluid and ease the strain on his heart. Let's move on to question number 2, a drag and drop to test your prioritization skills. This exercise is designed to challenge your critical thinking and decision-making abilities in a clinical setting. Imagine you're caring for a patient with impaired central perfusion. This means their heart is not pumping blood effectively and immediate action is required. You've got 4 nursing actions. 1. Administer oxygen therapy to ensure the patient is getting enough oxygen. 2. Assess blood pressure and heart rate to understand the patient's current status. 3. Elevate the patient's legs to improve blood flow back to the heart. And 4. Notify the healthcare provider to get further medical advice and intervention. Your task is to arrange them in order of priority. Think carefully about the sequence of actions that will best stabilize your patient. Think about what needs to happen first, what's absolutely crucial before you can move on to the next step. Okay, pencils down. Time to see how you did. The correct order is: start with the assessment, then move on to intervention. Remember, assessment always comes first. It's crucial to know the patient's baseline before taking any further steps. We need to know our patient's baseline before we intervene. Then, we address oxygenation to ensure the patient is breathing adequately, reduce venous congestion by elevating those legs to help blood return to the heart, and finally, loop in the healthcare provider to update them on the patient's condition and get further instructions. Teamwork makes the dream work, right? Always remember, effective communication and collaboration are key in providing the best patient care. Ready for a multiple response question? This time we're focusing on recognizing those telltale signs of impaired perfusion. Which of the following should send up a red flag? A. Cool, clammy skin. B. Strong peripheral pulses. C. Capillary refill greater than 3 seconds. D. Cyanosis. Or E. Blood pressure 120 over 80 millimeters of mercury. Remember, you can choose more than one answer here. Take your time, analyze each option and select all that apply. And the correct answers are A, C and D. Cool, clammy skin, delayed capillary refill, and cyanosis all scream poor perfusion. Those strong peripheral pulses and that normal blood pressure in options B and E, those are actually good signs we want to see. Alright, last question, and it's a tough one. This one is designed to challenge your understanding and ability to synthesize information. This is an extended response question that really makes you think critically. It's not just about recalling facts. It's about connecting the dots and seeing the bigger picture. I want you to identify 3 risk factors for impaired perfusion and explain how each one messes with the body's ability to deliver that life-sustaining blood. This means diving deep into the mechanisms and understanding the underlying causes. Think about lifestyle choices, pre-existing conditions, anything that could compromise blood flow. Let's break it down. Consider how these factors interact and exacerbate each other. First up, we have hypertension. This is a common but serious condition. We know high blood pressure puts a ton of stress on those delicate blood vessel walls, increasing the risk of damage and narrowing, which reduces blood flow. Over time, this can lead to significant cardiovascular issues. Next, we've got diabetes. This condition is more than just high blood sugar levels. This sneaky disease can cause microvascular damage and atherosclerosis, both of which limit blood supply to vital organs. The complications from diabetes are far-reaching and can severely impact overall health. And finally, let's not forget about smoking. This habit is incredibly detrimental to vascular health. Not only does it constrict our blood vessels, but it also significantly increases the risk of atherosclerosis, a recipe for disaster when it comes to perfusion. Smoking accelerates the damage to the cardiovascular system, making it a critical risk factor to address. And that's a wrap on our perfusion practice questions. Part 1. You guys did amazing. Remember, acing the NCLEX is all about understanding the why behind the what. So keep asking questions, keep learning, and keep practicing. Thank you for joining today's session. We hope these examples clarify perfusion concepts and help you feel confident for the NCLEX-RN exam. See you next time. Please like, share, and subscribe to our channel for more valuable content.